back to your Feel Good Breakfast show. It is Expresso right here on SABC3. Well, we're talking health and wellness, specifically yours as a man. And we are talking about testicular cancer this morning. If you do have any calls or questions for our expert, our medical expert, Dr. Darren Green, you can give us a call on 0839133728. Dr. Darren Green, we had a call during the break. William, he called us and he asked, what are the symptoms and the signs? I know you did touch on it, but maybe you want to do it again, because I think that there might be a few people that missed that.
Alarm bells, yeah.
Yes.
Yes, so the first thing is a mass.
Yeah.
So you need to recognize that there's an additional mass to the normal oval-shaped testes. There's an additional mass on top of that or attached to it.
Okay.
So, you know, you need to be able to understand what a normal testis feels like, and then obviously look at the cord, which is the epididymis above it, etc. So a pea-sized mass can be painless initially, as found. It doesn't disappear within 2 weeks, is the other fact. A rapidly growing collection of fluid in the scrotum, in other words, within 2 or 3 days, suddenly there's a large amount of a collection of fluid. That's important. Then a dull aching pain in the lower abdomen that cannot be explained. And when you have testicular cancer that progresses you even have things like pain radiating into the groin and the lower back that can't be explained in terms of musculoskeletal things. And then obviously we want to look at the spine and bone, etc.
Will it always exhibit as a mass? Are there cases where there
Indeed.
will be no visible sign?
You know, you get different types, two main groups of tumours of the testes. And the first one is what we call the seminomas, which generally occur quite late in older men. And then you get the non-seminomas. Now, the non-seminomas are the aggressive ones that occur. And it all refers to where the tumour originates from, which part of the testes. Is it the germ cell layer or the outer capsule? Or, you know, is it, in fact, inside the testis itself, where the cells then start growing uncontrollably? And those, the differentiation between the two, it leads us to, obviously, the prognosis, but also the presenting symptoms.
Okay.
All right, we've got Clinton now joining us on the line from Bloemfontein. A very good morning, Clinton. Thank you so much for phoning in and joining the conversation. What is your comment or question for the doctor?
Morning, guys. Morning, doctor.
Morning.
I just want to find out, I was 29 and I got testicular cancer, and I relapsed for about 4 years.
Wow.
Then it went to adrenaline glands that's in my lungs. I had it over my liver, and I had a big tumor. And because of all the chemo and the radiation I had, I've got like nerve damage in my feet. My feet feel cold, it feels swollen, a bit sore sometimes. That's the first thing I want to find out. And the second thing is my teeth, or my jawbone.
Yes.
It's declined. My gums and my my bone has declined. So I want to find out if there is anything I can do or take to try and sort that out of it.
Thank you, Clinton. Okay.
Great question. And what Clinton was referring to is he had a relapse. In other words, his testicular cancer was treated, and the three ways that it's treated normally, depending on the grade and the staging of the cancer, is obviously through surgery, chemotherapy and radiotherapy. And often the side effects of having radiotherapy can leave you with blood vessels that are affected. He mentioned abnormal sensation in the lower limbs. The side effects of having long-standing metastatic disease and then having radiotherapy, I don't know where he had radiotherapy, perhaps whole body even, you can imagine that leaves the blood vessels, some of them injured. Now, the nerves in the legs and fingertips, etc., all need blood supply to do their function. So when that's impaired or hampered by radiation, you often have then peripheral neuropathies that can develop pain syndromes and obviously with that comes also bowel abnormalities, and you mentioned the jaw as well and the jawline. I think the best thing Clinton could do is consult his oncologist again. It definitely needs a follow-up with his oncologist, firstly to look at if there are any modifiable things that he can do, you know, to curb or to stop the peripheral neuropathy specifically.
Oh, Clinton, thank you so much for weighing in on this conversation, and we're certainly there with you.